technical error on our end. Hopefully it's fixed now. But going back to you, Amparo, again, thanks for being here. And my question to rephrase it is, or re-ask it rather, is there a deck or a one pager or something that exists for employers that addresses the reasons people have for not being vaccinated yet? We know DHHS in North Carolina, DHHS did a good one to encourage vaccines when they were first being released to the public. But now we're kind of halfway through the early and middle adoption phase. What can we do to appeal to those who are late to accepting the vaccine, and those who are just straight against it, for an employer that does want to encourage them or require them to do that?
Hi, thank you for the invite, and hi to everybody again. Basically, I asked several staff at the health department, including our medical director, Dr. Molander, if we had something like a one-pager. Unfortunately, we don't know of one, but we know there's a lot of information out there, and if we find one, we certainly will email it to you, Corey, so you can send it, to the businesses. But I want to share that the CDC, and the North Carolina Department of Health and Human Services, they do have a lot of information on their websites about, what are the questions that people are, sending them related to vaccines, and what is true, what is a myth, what is a fact, how to deal with misinformation. So I wanted to share, but it's not letting me share. It's saying host disabled participant screen sharing. So let me see if I can try.
Can we give out the web address, and then when we set up the recording, we can put it in the description of the recording?
You can go ahead and try again.
Okay, let me try again. Okay, great. So the CDC has this, this basically, can you see my screen?
Now we do.
Okay. How to address COVID-19 vaccine misinformation. And then it has like a lot of information, for anyone that is looking, to see what are the facts, what are not the facts, and stuff like that. So that's something that I would refer people to. And like I said, if we come across one that is a one-pager, I will certainly, share with the group.
Okay. And that is just under vaccines and immunizations on the CDC general website. That's where you were?
Yes.
Okay. Well, thank you for that. We'll make sure to try to disseminate that as well, and also put it on our COVID relief page we have on the AshevilleChamber.org website. So bring it back to you for a minute. We have an employer that says they strongly agree that vaccines should be required in the workplace and any public place for that matter. However, with all the fake COVID vaccine cards out there now, how would proof of vaccines be verified?
So I think that, on one hand, that is something that the government is still working through, and lots of places are still working through. They're talking about apps on people's phones and all that sort of thing. In the meantime, that's one reason that I really like the idea of having your employees affirm that they've been vaccinated and the dates and sign off on that, because then at least they are telling you this, and they're agreeing that if they're giving you incorrect information, that could be a fireable offense. And I think that is just like you trust your employees to do lots of other things. That's a way to, this is an official company document. You're affirming this to us. That's a way to try to get around someone just presenting you with a fake card. I feel like, somebody has to sign their name to something and attest to it and say that they understand they get fired if it's wrong. I think that's a little bit stronger than just having somebody show a card right now.
And, correct me if I'm wrong, Amparo, but I think folks can go down to at least in Buncombe County, can go down to the health department and get a printout with a QR code on it that verifies you've gotten both your doses of vaccine or whatever it is. Is that true? I'm pretty sure that you're able to do that right now, right?
We have access to the state system, where the pharmacists and all the different places that are providing the COVID-19 vaccine have to enter the information into. So we can certainly provide people with with a copy of that. Someone that might lose their card. What we also recommend is as soon as someone gets a vaccine, take a picture with your phone of the card. I did that myself because those cards are very small. But yes, we have the capability of printing a report as well.
Yeah, the reason I learned about that is because traveling, some venues and things are starting to not accept vaccine cards. You have to bring in that unique QR code, which is statewide system, and I'm sure nationwide too, but I know it's at least in North Carolina. So that's something to consider too for the person asking that question. Right now the Pfizer vaccine is the only FDA approved vaccine. If we mandated that employees get vaccinated, or if a company mandated that their employees get vaccinated, could they take any of the three available in the US, or should they require that the one that's approved, the Pfizer vaccine, be the only one they take as far as the mandate goes?
So I think that's a really interesting question. I certainly would say if you are going to host any kind of clinic at your workplace, I think having it be a Pfizer clinic would be ideal right now because that is the only approved one. But I don't think that there is a significant difference in the risk. And if you allow employees to choose, then employees can decide. And I know I have heard that there are some people who may be able to get the Johnson & Johnson who can't get the other, or vice versa. And so, I think that if you mandate it, you're mandating just the vaccine. But if you have a clinic, I definitely would recommend that it be Pfizer right now until the others get approval.
Okay. Going more into, we have a question here, Empire, for you, going more into the field of acceptance and reluctance to get a vaccine. And someone said that they're looking for an African-American medical health professional or epidemiologist that could speak to their staff in order to help build trust around getting vaccinated. Do you have resources for situations like this? Now, I'm sure there's others too, not just an African-American community that are having issues with adoption of an exception around the vaccine and discussion around the safety of it. Are there resources available for employers in this situation?
That's also a very good question. And I have to say that I had to send an email to a regional consultant for the state to see if there's something out there that we can, share a list of, I guess, minority health professionals, or as you can probably notice, I am a minority health professional, but there's not many that I know of, unfortunately. And African American, I can think of one name, which is very sad, right? Because I would like to think of a whole list of names. But I know, Sharon West, people might be familiar with her. She works at the VA. She's a nurse. She's very, very smart, very up to date with information. She's the one that comes to mind. But unfortunately, I don't know of a place or a list or somewhere people can go and get that, information for more. But definitely, again, once I get more information from the state, I'll send it to you, Corey. Maybe they have something that I don't know of.
Yeah, and I think that that's not a unique situation to any minority group or another. I think there's a lot of people out there with just safety concerns in general. And so I think if we can do anything to share that and alleviate those concerns, and at the end of the day, I think people just need to stay in close contact with their medical professional, their nurse, their family doctor to know whether it's safe for them or not. But generally, getting that information out in a specific, in a generic way, I think would be very helpful, and we'll definitely share that any updates we get on our website. So let's go back to sort of the religious and medical exemptions that we were talking about, and you discussed, Sabrina. How are you advising businesses to accommodate individuals with the religious or medical exemption? I know you kind of touched on this with, if you have the ability, if they can work remotely, it's obviously the ideal situation. But if they can't, what are you doing to advise businesses in that situation?
So if folks can't work remotely, thinking through, masking, of course, right now we're all having to mask, but, there hopefully will be a time again in the future where we're not all having to mask. And so masking may be an option, thinking through that person's interactions with the public and with coworkers, and if there's a way to limit those, or I've had people who've used plexiglass, move people to different offices or conference rooms, really kind of thinking through all the ways that we're told that you can try to prevent COVID spread, wearing a mask, distancing, all those things, to see if there's a way to accommodate people that way. And again, thinking through, the vaccination rates of the people that they are most likely to be around in deciding what makes sense, I think is really important there too.
Yeah, and on the heels of that, and the same question, in the same vein, can employers impose a surcharge on an employee who's not vaccinated? And I would assume this means not under one of the exemptions and not vaccinated. Is there some sort of penalty that an employer can legally charge?
So I know that there was a big news story, I guess it was last week or maybe the week before, that Delta Airlines was increasing the amount of people's insurance. I think that if you're self-insured and you have control of your plan, you may have some options around your insurance premiums, the way some folks do with smoking and other things. Again, that's all a little untested at this point. And, the accommodation issue, I think, would need to be very clear on that. Now, I do know some places who are, and this goes more to the incentive question, but are able through their health insurance, if people can earn points to reduce their health insurance premium. A lot of places are adding COVID vaccination as a significant point value in their wellness programs. So that's something that I'm certainly seeing a lot of.
Yeah, I think that even goes sort of to that's more of an incentive as well, right? Than a penalty of some sort. Now, Amparo, like we're hearing a lot of it for like misinformation out there sometimes, but and we know that the rates have kind of gone up here recently with the Delta variant surge. But what are the actual percentage of COVID-19 hospitalizations from people who are partially vaccinated versus unvaccinated versus fully vaccinated? Do you have those numbers?
I have some numbers, and I'm gonna share my screen again.
Okay.
Because I think it's important that everybody knows where to go find this information, right? Because it's available and it's out there for anybody to look for, to see. So I will say this: the state at the North Carolina Department of Health and Human Services website has a page. They call it CLI surveillance, and they update this weekly. And if I go to the dashboard, and then once I'm at the dashboard page, I click on CLI surveillance, then it brings me to basically this page that is updated every Thursday by 4 p.m. Okay, so when I click on this surveillance summary for COVID-19, it takes me to another page, basically with some data and a specific data about what's going on in North Carolina. Related to your question, I would like to point out to these two graphs. I'm a visual person, so I like to see it in the screen. So one of them is, hold on, let me get to the right one, because there's a lot of information in there. But the one that I want to show, hold on, let me get to. So like this one says, which the emergency room visits, compared to last season for COVID like illnesses. So as we can see, this red line, those are going up. So that's for people that are going to the ER for that. And then there's a graph, let me find it. This one, what is the risk of getting COVID-19 for people who are vaccinated versus unvaccinated? Okay, so this orange graph is for people that are vaccinated. We know that people that are vaccinated can still get, COVID, but is less symptoms and less chances of going to the hospital or dying from COVID. And then you can see this blue line of the people that do not have the vaccine, is definitely, the risk of getting COVID is bigger. So some people might say, well, most people get better with COVID, and that is correct, but a lot of people have died from COVID. So this other graph is basically showing the people who are vaccinated versus unvaccinated and the risk of dying from COVID, right? And these people will be in the hospital, most of them, very sick. So as we can see again, the orange line are the vaccinated people, which is very low. The risk of dying from COVID is very low. And then this other blue graph, as we can see, is the unvaccinated people dying from COVID. We know that is very high. And if you are looking at this on a weekly basis, you can see some information down after the graph. Basically, unvaccinated individuals are 15.4 times or 1,540% more likely to die from COVID than vaccinated individuals. So I hope that answers the questions. I know it's not very specific about hospitalizations, but this is the data we have about, people that get sick and go to the hospital and die compared to vaccinated and unvaccinated.
No, I'm glad you showed that, and I appreciate the visual description. I was looking at just the contraction rate. It looked like it was 6 to 7 times more likely in unvaccinated, and then but the 15.4 times more likely to die if you do contract it is
Yes.
just an astounding number.
Yes, it is. Unfortunately, it is. Yeah.
Because you hear a lot of the opposite, right? Especially with the Delta variant. And I guess I'll ask that then. That's some. It's not in this list of questions, but I'm curious because I hear this all the time. Are the vaccines effective against the Delta variant that we're seeing right now?
Yes. And actually, I am a visual person, so I'm gonna show my screen again.
Sure, go for it.
Uh,
You just leave it up there.
this is actually from the CDC, okay? And this is COVID-19 CDC website, COVID-19 vaccines work. And people can, again, this is public. Anybody can go in here and read this information. So at the bottom, what we know about the variants in the vaccines is that the COVID-19 vaccines that we currently have protect against the Delta and other variants. Now, there are new variants. Unfortunately, this virus keeps mutating, right? And that's not good because there are always new variants that might come up. Now we know that the Delta variant is the one that is circulating in the United States more than other variants, but there are other variants as well. So we know that the vaccines work for the Delta variant. What we don't know is, any other new variants that might come up. And again, this is a novel new virus. I know people get frustrated because information changes, recommendations change. We're learning because it's new. So, but what we know is, yes, they protect against the Delta variant that is circulating right now.
Okay. And I mean, obviously, it's not impossible. I mean, there's always a chance you can contract it even if you are vaccinated. But the real thing is the serious risks are substantially reduced if you are vaccinated. And I think that's an important point to make from a public health standpoint.
And let me just say, that is the case, Corey, with every vaccine. We don't have a vaccine that is 100% effective. A lot of people get very nervous with this. and also the technology for these vaccines is not new. We've been studying this technology for years.
Mhm.
So that's for any vaccine. And I understand people get afraid, people have questions, again, we are all learning about this new, virus that is affecting the whole world. You have to do your pros and cons. I'm not pushing for or against, but I will say that we know that vaccines work. So
Okay. Thank you for that. So bring it back to you. What, from the employee standpoint, can an employee refuse to come to work if their place of employment does not require vaccines?
So, an employee can always refuse to come to work and quit if they don't feel like their workplace is safe for them. Can they refuse to come to work and have their employer, not fire them for the employer refusing to mandate vaccines? Right now, no. I think that would be very unlikely. Their OSHA does have some requirements around employers providing safe workplaces generally. And so certainly if an employee believes that their employer is not following current CDC guidance, city and county mandates, that's something the employee should definitely bring to the employer's attention. Because even so, right now in North Carolina, if you don't believe your workplace is safe due to COVID and you quit, you may be eligible for unemployment, but you have to be able to show that you brought the issue to your employer's attention and that there was some dialogue around it. And that it is a requirement right now from the CDC. Well, requirement's a strong word. It is part of CDC's guidance and protocol right now. So right now, requiring vaccines is not part of that. So I don't even think, I think it would be very unlikely you would qualify for unemployment right now based on the vaccine question. But, certainly if there are things that the CDC is requiring or strongly suggesting that your employer's not doing, I certainly would encourage employees to point that out to their employer. Or if an employee, has concerns about the safety of their workplace, certainly bring that to their employer's attention and have a dialogue around that. But right now, vaccines is just not on that list. So you can always quit, but there's not going to be a lot of protection around quitting because your employer didn't mandate vaccines.
Right. And I think from a legal recourse standpoint, that's probably what the answer they were looking at.
Mm-hmm.
So I'm going to let you tell us what this acronym stands for, but under FFCRA, can employers choose to pay vaccinated employees but not pay unvaccinated ones?
Right. So the FFCRA is the Families First Coronavirus Response Act. And that was passed, the first iteration was passed back in March of 2020. And folks may require that from April of 2020, or may remember that from April of 2020 through December of 2020, employers who met certain requirements related to number of employees and that sort of thing were required to pay employees for time away from work for certain things related to COVID. If they got COVID, if they were quarantined, if their child was out because of school because of COVID, there were a number of things, and that payment was required, but there was a payroll tax credit. Then from January of 2021 through March of 2021, there was an amendment to that act that said, if you want to provide that pay, you can still get the payroll tax credit, but you're not required to. Then there was an additional amendment that started in April of this year that is going through, I believe, the end of September. And it may get extended again, given where we are with COVID, that said, you can still voluntarily provide that pay and get the payroll tax credit, but it puts some more requirements on employers around paying for people to go get vaccines, for vaccine reaction, that sort of thing. And it made clear that employers could not pick and choose who they were paying or not paying. You either had to pay everybody who qualified, or not if you want to get the payroll tax credit. So I've gotten this question a lot from folks, and I think you can, or you might choose to delineate maybe with giving extra PTO or that sort of thing to people who are vaccinated, but you're not going to be able to get the payroll tax credit under the FFCRA, I don't believe, if you're picking and choosing in that way around who you're paying and not paying if they have COVID.
Okay, great. I think that's a good question to end on. I will say I received an email just now from the Western Carolina Medical Society in Paro. I don't know if you're familiar with them, but they did say that they are compiling right now a list and helping people through their organization with a list of African American and Latinx providers. And so they're working on educating the public through that. So I haven't checked out their website or resource, but that could be one option. And certainly the more information we get on that, we will share that out with folks if they think that's going to be helpful. And
That's great.
Yeah. Well, so thank you all very much for your time. It seems that basically my summation is that, yes, you can ask for vaccine cards and you can require it if your employees are coming to the workplace. And that's outside of any restrictions from ADA compliance, as well as Title VII religious exemptions. So that was my big takeaway. But I do hope everyone got a lot of information out of this today. I know I did. I really hope that I tried my best to get through as many questions as we could in the time that we have allotted today. So apologies if I didn't get to your question, but we will have this recording up on our website and on YouTube very soon. And if you have follow-ups, please do so with myself or Sabrina or Amparo. I'm sure we'll be happy to answer follow-up questions. And thank you all for attending today. Join me in thanking Amparo Acosta from Buncombe County Public Health for being with us today, as well as Sabrina Rockoff, the managing partner at McGuire Wood and Bissett. I've been Corey Atkins, Vice President of Public Policy and General Counsel here at the Asheville Chamber. Thank you all so much for joining us today, and hope you have a great holiday weekend.
Thank you. You too. Bye.